here at the Natick Mall. I'm Bill Haas, Senior Vice President of the Northeast Division at LabCorp. We're thrilled to be working across the Commonwealth to make it easier for people to get tested and vaccinated as we all work together to slow the spread of COVID-19. 2 weeks ago, there was nothing here, and LabCorp went to work. This quick transformation of this old Sears store is a great example of how LabCorp works with federal, state, and local leaders across the country to develop thoughtful and creative solutions to expand access to testing and vaccines. This week, we are vaccinating 100 people per day here in Natick, while we are getting hundreds of nurses and nursing staff trained and ready. Next week, we'll ramp up to 500 per day. And by April, our goal is to be vaccinating up to 5,000 per day, 7 days a week. On behalf of LabCorp's 70,000 employees, I'd like to thank Governor Baker, Lieutenant Governor Polito, Secretary Sutters for being part of this event. Also in attendance today, we have Representative Linsky and Senator Roush. Thank you for being here. This LabCorp vaccination site would not have been possible without the support of the Department of Health, our community partners at Metro West Medical, Ava Collins and Steve Baraletti, who are providing staff, vaccine storage, and supplies. A big thanks to hundreds of LabCorp physician customers, clients in the area who've helped us supply and recruit nursing staff. Brookfield Properties, Jennifer Kearney and her team, thank you very much. They've provided, obviously, this space, but so much more they've done over the last 2 weeks getting ready. And our heroes at the Natick Police and Fire, as well as a Brewster Ambulance. All three are supporting us with staff and on-site emergency personnel. And a special thanks to Chief Hicks of the Natick Police. And of course, our generous residents who have supported LabCorp and turned out to support us during this event. So it's a true community effort, one we are honored to be a part of. We are humbled to work with all of you and appreciate the opportunity to use our scientific and our population health expertise to improve the health and improve the lives of the great people of Massachusetts. Together, we will slow the spread of this virus. It's now my pleasure to introduce Governor Baker.
Thanks, Bill, and thanks to the entire team at LabCorp for joining with us in this effort. I recall just about a year ago visiting your operations on the lab side here in Massachusetts to talk about expanding testing capacity here in Massachusetts. And I think at that point in time, we were talking about trying to get to maybe 3,000 tests a day. Seems like a lot more than a year ago when I look back on it. And I also want to just thank all the other folks who were involved in setting this up. I know we were looking to see if we couldn't get to the point where we were doing 5,000 vaccinations a day here, and I was curious to see what the space would look like, and I'm no longer worried about the space. I think this one's going to be just fine with respect to that, and I want to thank Senator Roush and Representative Linsky for being here, and I have to say, Representative, and I said this to you before, as an old Needham Rocket, it's always a little interesting to come visit you as a former Bay Stater yourself, and to see the Natick High School mask on there, just to remind me that I had some long days on the basketball court against those guys. I also want to say that in many respects, the news out of Washington on some of this stuff right now is actually encouraging. I hesitate to draw too many conclusions about it because honestly we've been disappointed before by some of the things people told us were going to happen and then what ultimately happened with respect to vaccine production and distribution. But on the same day to have Johnson & Johnson's vaccine deemed safe and effective by the FDA, and to have Moderna and Pfizer say they would double their vaccine production in March over the level of vaccine production they did in February is a really positive development in so many ways. And I think for all of us who are continuing to struggle with some of the issues around the anxiety that's created by the lack of supply, this could be a really big moment if, in fact, what folks are saying actually plays out over the course of the next 30 to 45 days. With respect to the public health data generally around COVID, yesterday DPH reported 1,114 new cases out of about 62,500 tests. We're continuing to see good signs in that data. The 7-day average positive test rate now is 1.89%. That's a number that looks like something we used to see back in October. There are 879 people hospitalized with COVID, which is obviously down from over 2,500 about 6 weeks ago, and about 225 people are in the ICU. That's a 65% plus drop over the course of the last 6 weeks. The metrics have continued to improve over the course of the past month and a half, which is very encouraging. At the same time, we've seen significant increases in vaccinations here in Massachusetts. As of yesterday, the vaccination report indicated that we've received about 1.7 million doses of vaccine, and about 1.4 million have been put into somebody's arm. That's about an 85.5% administration rate, a number that's continued to climb over the course of the previous few weeks. We are number one among our peer states, the 24 states that have more than 5 million people, in vaccines dosed, first doses delivered per capita, and nationally we are currently in the top 10 for all 50 states and have been there for the past several weeks. And as of this past Friday, over 300,000 residents over the age of 75 have gotten their first dose in Massachusetts. That's a number that's north of 60% of that population. That's also significantly above the national numbers for the over 75 crowd at this point. And obviously, those folks will continue to get vaccinated as we move forward. But as we've said before, we can only vaccinate based on the vaccinations we get from the feds. And that's why the news out of Washington could end up being such a big deal. We currently get, as we've said before, about 130,000 doses, first doses a week, which is the way we keep score on this. And we certainly hope that the news we've heard means we will have a chance to significantly increase the number of first doses that are available to people here in the Commonwealth. As everybody knows, we moved ahead on eligibility to people who are 65 and older and those with 2 or more certain medical conditions. And tomorrow morning, somewhere in the vicinity of about 50,000 new appointments for first doses will be made available on the state's website here in Massachusetts. We expect the total number of doses administered to be about the same next week, maybe a few more first doses as they were last week. And there will be second doses, obviously, that continue to get delivered to people as we move forward. But that first dose number is still somewhere in the vicinity of about 130,000. It's important for us to see that number move. And as we've said before, people can make appointments at mass.gov/COVID vaccine. People who don't have access to the internet or are unable to use the website can call 211 to book an appointment. Somewhere in the vicinity of 15,000 appointments have been booked at this point through the call center. And I can't stress how important it is for people to remember that vaccine locations in Massachusetts, all of them, operate by appointment only. If you have an appointment, you're going to get a vaccine. That's the way this program is set up. To prepare for a surge in the traffic due to the new appointments that will start tomorrow, we've been working with our tech team to improve the site's capabilities and functionality to deal with big numbers, and the site will have bolstered server capacity to help manage heavier website traffic. That also means, among other things, that we're implementing what we're calling a digital waiting room, which is a feature to prevent outages on the scheduling website for MassVac sites. What that basically means, if there's high travel and traffic on the website. Some users might be placed in the waiting room. The page will display more information about when you'll be allowed to proceed, but it's basically the equivalent of creating a line, and people would then move from their position in the line onto the website when the next opportunity to be on the website became available. It's designed to basically keep the site running and operating and to make sure people can get through and have a smooth and uninterrupted experience. We certainly expect the site's performance tomorrow to be significantly better. Appointments will obviously be booked quickly. When you have 50,000 appointments and somewhere around 1 million people who will be looking for them, we anticipate they'll go fast. But as we've said before, the whole issue here requires a certain amount of patience. And I know everybody would like to get vaccinated immediately if they qualify, and I certainly know that all the folks who do the vaccinations for us here in Massachusetts would like to be able to put all of the vaccine that they've been requested to work. But until we see an increase in federal supply, that's simply not going to happen. We currently get about 450,000 requests each week for first doses. We get 130,000 first doses from the feds. We certainly hope and anticipate that those numbers will change going forward, because two things will happen then. The first will be sites like this one will have more vaccine to distribute to people, and people will have more appointments that they will be able to book, which means we can go more quickly through each phase of the vaccine rollout process. If we don't see an increase in vaccine, we expect it'll probably take about a month for everybody who's currently in phase 2, this step in phase 2, to get an appointment. If we see an increase, obviously, in weekly first dose vaccines, that process might go a little quicker. And obviously, we will do everything we can to make sure people know if the feds change their allocation policies based on some of that news that came out of Washington yesterday. And when they know, and when we know, we will certainly make clear to the public what that means with respect to people's ability to access additional appointments. We also announced last week efforts to streamline the vaccine distribution process to get more shots into arms more quickly and to reach some of our hardest hit communities. That included a new initiative to promote vaccine distribution in the 20 cities and towns that have been most disproportionately impacted by COVID. We announced $1 million commitment to our community health centers to work with them to reduce barriers to vaccinations in the communities they work in. And today we're building on that with a $4.7 million investment in these 20 priority communities. We're working with 2 organizations to help us leverage these funds to best reach populations in these communities, Archipelago Strategies Group and Healthcare for All. Both of these organizations are extremely well known to the communities that they will be working in. And these funds will be used to work with local leaders and community and faith-based organizations to strengthen existing efforts to reduce barriers to vaccination and to increase awareness about the efficacy and safety of the COVID-19 vaccine. This will include multilingual vaccine awareness events, services to help people navigate logistical barriers to the vaccine, especially people who are homebound or otherwise unable to get to a particular location, and others who might find certain kinds of challenges in front of them that need to be dealt with. The awareness efforts will complement the $2.5 million public awareness campaign with respect to vaccine hesitancy that's already running here in Massachusetts. In a minute, Secretary Sudders will talk a little bit more about these efforts, which will strengthen our focus on these 20 communities, the people who live in them, and the important issues associated with encouraging them to get vaccinated when they are eligible. We'll also focus on ensuring that our local partners can continue to help us open more vaccine sites statewide for our residents. Currently, about 95% of our population lives within a 45-minute drive of a mass vac site or within 30 minutes of a regional site. To make the vaccine more accessible, we're working with municipalities to help them develop additional regional collaboratives that can quickly and effectively administer vaccine. Those collaboratives will enable local officials to work with the vaccine process and to support players in their areas while ensuring that we continue to have a high-efficiency distribution system. Regional collaboratives must meet certain criteria, have the ability to vaccinate a minimum of 750 people per day for 5 days a week, and they have to be open to all eligible people in the Commonwealth. And today, Lieutenant Governor will talk a little bit more about the 11 regional collaboratives that are already in place and a little bit around some of the rules and the details associated with those initiatives. They cover, in many respects, many parts of Massachusetts that have a lot of geography and have proven to be very effective at delivering vaccine. Obviously, I can't thank all the staff and the volunteers at these sites across the Commonwealth for the work that they're doing to make sure that we continue to put every dose we get into somebody's arm when it's available. And I think in many respects, the work that's been done here in Massachusetts over the course of the past year, as we've all worked on COVID, is just another indicator of the way the people in Massachusetts have come together to deal with this. We still have a way to go, but I just have to close by saying that the data on positive test rates, the data on hospitalizations, the data on many of the elements associated with COVID presence in the community here in the Commonwealth has been moving in the right direction now for over a month. The vaccine program has ramped up to the point where over 1 million people have received their first dose here in Massachusetts. Many of our most at-risk and vulnerable populations have been vaccinated. And if the feds can amp their supply up a bit, we absolutely have capacity here in Massachusetts to absorb that supply, turn it around, and put it in people's arms so that we can continue to expand our vaccinated community here in the Commonwealth. And with that, I will turn it over to the LG.
That's great. Thank you for the for the claps. I can see you're very excited here, as we are too, to be in Natick with our partners in LabCorp, as well as Metro West Healthcare, and with our colleagues in the legislature, Representative Linsky and Senator Roush. Thank you so much for your leadership. And thank you, Governor, and Secretary Sutters, who will speak in just a moment. It's really great to be here, and as the Governor talked about, we appreciate the work of our local officials and all of the work that they're doing. And I want to just elaborate more on the regional collaboratives. They obviously are playing an important role to fill geographic gaps in our Commonwealth, and they are important to all of us, including access to vaccination sites and being supported by local health officials and others to make sure that people are able to get the vaccine at a site that is convenient and accessible to them. These sites, the MassVac sites, offer a high volume and efficient rate of delivery of the vaccine, and we recognize that these collaboratives also play these sites, as well as the collaboratives, play a crucial role in vaccine delivery. This approach is designed to ensure vaccines are distributed throughout the Commonwealth in a highly efficient and accessible way. And today we are announcing 11 collaboratives in regions across our Commonwealth that have been sort of approved by our Department of Public Health. And these collaboratives are Barnstable County, Berkshire County Boards of Health Association, the Franklin County Regional Collaborative, Franklin Hospital and Harrington Hospital in Southbridge in collaboration with local health departments, Hayward Hospital in Gardner in collaboration with local health departments, Lawrence General Hospital in collaboration with their local health departments, Marshfield Plymouth Regional Collaborative, as well as the Northampton and Amherst Regional Collaborative. Randolph is a collaborative between Avon, Holbrook, and Randolph local health departments. Rutland is the lead community for a regional collaborative, and in Worcester, a collaboration with Worcester State University, Commonwealth Medicine, and St. Vincent Hospital. There's obviously a lot that goes into setting up a regional collaborative. Finding the right partners in the right place are two components, and then a delivery commitment over a 5-day span of 750 minimal doses requires a strategy and a commitment that obviously many need to support to make sure that they can fulfill. We thank all of our partners from these sites. Now we have 7 across our Commonwealth, our regional collaboratives, as well as our CHCs and our retail pharmacies provide a lot of capacity, as the governor said, for access and efficient delivery of vaccines throughout our Commonwealth. So thank you all very much for your hard work today. The site looks terrific. Those who choose to make an appointment at the Natick site will be very pleasantly welcomed and supported through this effort. We thank you so much for setting this up today. I'd now like to turn it over to Secretary Sutters.
It was truly hard to imagine what this, I received photos of like the empty space, and so to actually walk in and see it filled is really remarkable. So thank you for that. Governor, Lieutenant Governor Bill, and to all of your colleagues at LabCorp and Metro West and the City of Natick, thank you so much for what you're doing here in Natick. This morning, still morning, I'll give some more details on our commitment to vaccine awareness and equity in our most disproportionately impacted communities, and give an update on our call center operations. As the governor indicated, last week we announced the launch of a targeted outreach initiative to the 20 hardest hit communities in the Commonwealth from COVID-19, and today the $4.7 million contract is going directly to support this work. The initiative aligns with our commitment to prioritize health and racial equity and to keep community at the center of our vaccine distribution plan. The Department of Public Health is partnering with the 20 cities and towns most disproportionately impacted by COVID to listen, to bring boots on the ground in order to address vaccine hesitancy, to increase awareness of the vaccine's safety and efficacy, and hopefully to reduce the barriers to vaccine acceptance. The work will be done with the help from Archipelago Strategies Group, which is a minority business enterprise in the Commonwealth, and with support from Healthcare for All, and launches this week and will continue through at least June 30th of this year. Archipelago specializes in grassroots mobilization, partnering with local leaders, local community organizations, and media partners to develop community-based solutions. And as many know, Healthcare for All provides high-touch support for priority communities, including direct service support, community organizing, education, and outreach. The Department of Public Health will work with local leaders and community and faith-based groups to overcome these barriers. Outreach will focus on helping to increase the awareness about where, how, and when to get the vaccine, and navigate logistical barriers for community members, homebound seniors, and other individuals with questions or concerns about eligibility, registration, and access. And just to remind you of the 20 communities, they are Boston, Brockton, Chelsea, Everett, Fall River, Fitchburg, Framingham, Haverhill, Holyoke, Lawrence, Leominster, Lowell, Lynn, Malden, Methuen, New Bedford, Randolph, Revere, Springfield, and Worcester. This initiative will ensure our communities most disproportionately impacted get the assistance and support that they identify that they need to ensure that we can vaccinate as many residents as possible. We are committed to the efficient, effective, and equitable administration of vaccines across our Commonwealth. Now, an update on the call center. Since the launch of the COVID-19 vaccine scheduling resource line, otherwise known as the call center, on February 5th, there have been 171,000 total calls. Between February 5th and 17th, the center averaged about 4,500 calls per day. And since we launched the newest priority group last week, volume increased to an average of 24,000 calls a day. 12,000 appointments have been booked for folks utilizing the call center, and any person who has challenges with using technology, any person who's eligible can use the call center. Even with the high call volume, the average wait time has remained about 4 minutes or less. A reminder that this call center, as I said, is for any individual eligible for vaccine who does not have access to internet or a computer. And you can reach the call center by dialing 211 and following the prompts for appointment booking. The center operates in English and Spanish and has access to many other language and translators. Those who are able to book online or have someone in their lives to help them book online should do so. As a reminder, the resource line hours are Monday through Thursdays from 8:30 to 8 p.m., Friday, Saturday, and Sundays from 8:30 to 5 p.m. So congratulations on this mass vac site. It'd be great if we have the vaccines to get up to 5,000 a day and be able to fill this space for even more. And with that, I will turn it back over to the governor.
Questions?
What will tomorrow look like? You talked about some website improvements. What's it going to look like tomorrow? Is it going to be a lot simpler, a lot easier? People aren't going to have to worry about the website crashing?
I think a lot of the work that's been done over the past week has been designed specifically to make sure that the website can handle extraordinary volume over a very short period of time, which is basically what happened last week. And we believe the waiting room in particular will, which is a tool that a lot of people use when they don't know exactly how much traffic they're going to have, will be a very important part of making sure that people have access to the site and the ability to determine if they can make an appointment.
So a lot simpler. Is that how you characterize it? How would you characterize it?
Well, I think the first thing is to make sure that the site itself actually performs. The site did deliver 50,000 appointments last week on the day that it crashed in the morning, but it was a really rough and rocky user experience. I think what I would say for tomorrow, the most important thing from our point of view is that the experience be predictable. There are additional features that people are going to be adding to the site on a go-forward basis that I think will make the user experience better than it is now. But the most important thing we want tomorrow for people is that that experience is predictable.
What else are you looking at?
Pardon me?
What else are you looking at? What other?
Well, several people have raised issues about developing some sort of mechanism to make it possible to sort of freeze an appointment if you find one, and then begin the process of filling in the information. There are multiple entities that website connects to, so we have to figure out a way to make sure that we can hold through other people's systems to make that work. But that's something many people have expressed an interest in having us do, and it's something that we plan to put in place.
Governor, would you encourage people who are eligible to maybe wait a week or two to kind of put that rush tomorrow down? Put that.
You know, we've been saying for a while now that we have more than enough capacity to serve a lot of people in Massachusetts on a daily basis. And today is kind of one more example of what I mean by that. But we have a really limited supply. And because we have a limited supply, it simply won't be possible for everybody who is eligible and wants to get vaccinated to get vaccinated. However, over the course of several weeks, even if it's at 130,000 first doses a week, we can move through a lot of people. If you think about the 75 and over population, they went live 3 weeks ago, and over 350,000 of them at this point have gotten their first dose. So, it will happen. The big issue is it just takes longer than anybody would want it to. If the news that came out of Washington actually translates into really significant increases in supply that are being made available to states and to vaccination sites and providers and everybody else around the country, starting in March, is real, and J&J is in a position to actually start distributing and enhancing their manufacturing capability, we might end up in a point where we would have enough vaccine to actually service the capacity we've already got in place, which would significantly improve how fast people could get their appointment, how fast they could get through the system, and would make everybody a heck of a lot happier. But I do think if you don't get an appointment tomorrow or over the weekend, the message I would say is you will, right? You will get an appointment. If you look at this from the beginning, 1.1 million people in Massachusetts have been vaccinated since this started at the end of December. People will get an appointment, they will get vaccinated. The real big outstanding question is how much capacity are we going to have from the feds, and how fast is the amount that we get from them going to go up?
When do you hear from the feds the next number? Is that a Wednesday night thing? Or?
I think isn't it a Wednesday night thing? I mean, the number we're getting next week, I think, is 139? Is that right? 100 of first doses?
So it's the same number, the supply hasn't changed. What the federal government has indicated is the expectation that every Pfizer vial now should have 6 doses rather than 5. So it looks like we're getting a little bit of an increase. So there's no difference in the supply amount, but the expectation that every vial of Pfizer will now be 6 doses.
Instead of 5, yeah.
Starting next week.
Governor, I'm thinking about just talking about reopening. If you ended your comments with the health data doing really well over the last few weeks. Capacity, more things opening. People have been asking us, business owners wanting a breakdown, they've been cooperating, get the numbers down.
We've been working through a bunch of issues with a number of folks in the employer community about this, and we will have more to say about it this week, but it won't be today.
Governor, could I ask you about the timing? Last week you had said 8 a.m., you might want to check then, and then, it was across. Some people told me there were appointments there at 6:15. Yeah, they went early. Are you reluctant to release a time because of this approach to people?
Well, keep in mind that we're a conduit to some extent for a number of different organizations and entities that make appointments available through that site. CVS makes appointments available through that site. Walgreens makes appointments available. The regional collaboratives that the Lieutenant Governor talked about makes appointments available. The mass vaccination sites make appointments available. And because there are a lot of different entities that are making appointments available, we don't always have the ability to issue an edict on when those appointments go up. And so what I would say is I don't want people staying up until midnight and trying to get on the site then. But what I would say is I think people should anticipate that over the course of the morning tomorrow, the various players and entities that participate in offering appointments on that site will be making appointments available.
But the mass vaccination appointments, are those your call, mail at once?
They'll probably go over the course of the morning as well.
Governor, how would you roll Johnson & Johnson in? I know like Fenway, I think does Pfizer, how would Johnson & Johnson kind of roll into the system?
I think it would depend to some extent on how much volume we're talking about with respect to their performance out of the gate. I do think one of the things we'll talk to everybody who's part of that supply chain about is I want to make sure that the supply chain, the people who are actually doing the vaccinating, whether they're providers or regional collaboratives or mass vac sites or community health centers or others, I just want to make sure that everybody is clued in a way where they are very comfortable that whichever vaccine they're using, they are sure they are going to be able to be clear to the people that they deliver it to about what it is, how it works, and whether or not they need to come back. The other issue that's obviously going to be part of this as well is the issue around storage is a lot different for J&J than it's been for some of the others.
Governor, can you talk a little bit about the decision to allow hospitals to start vaccinating again, why the change, and how will things be different?
So hospitals have been vaccinating since the beginning of this. In fact, I think the first piece of supply that we got actually went to hospitals. And at this point in time, hospitals have delivered more, and health systems, okay, have delivered more vaccine to more people than anybody else who's part of this world. And as we saw not much change with respect to supply, we told a number of the players in the provider world that there was going to be a pause on first doses. We now know we're going to get a little more than we got before. And I think as time goes by, if we get sort of any kind of significant increase in doses from the feds, you'll see providers do a lot more vaccinating. One of the things to remember about providers, the ones who work with regional collaboratives participate in our website and serve the public. But a lot of the provider community does outbound work to their patient populations, and they, basically call them and tell them, you can come in and get an appointment and get a vaccination. You're eligible. We would like to do that for you. So there's two universes here that we're focused on. We have multiple channels to distribute vaccine, but we have two universes. One is outbound calls coming from providers to patients who are theirs to bring them in, right? But there are a lot of people out there who would like to get vaccinated for whom that channel isn't necessarily going to work, which is a big part of the reason why we put together a pretty robust collection of providers, boards of health, mass vac sites, community health centers, and others who can actually serve people by appointment if somebody reaches out and says they want to schedule one.
And with Johnson & Johnson and the data don't have a lot more vaccine. Do you anticipate it getting to a point where people can choose which one they want?
I would prefer people to just, if you get an appointment here and they're doing whatever they're doing here, come get vaccinated. If you get a call from your provider, your clinician, and they say they'd like you to come in, I mean, I get a flu shot every year. I have no idea who makes that flu shot. But I know for the most part it's a good thing. And I think if somebody wants to only have to get one dose, right, which is the difference really between J&J and Pfizer and Moderna, we will do what we can to make sure people have some ability to get a one dose.
Doctor, why isn't there a state-run mass vac site in Worcester County? Do you see that coming to fruition in the near future?
We have multiple regional collaboratives in Worcester County. We have, Lieutenant Governor just walked through 3 of them. I think there's 4 of them, right? There's one with Harrington Hospital in South County. There's one with Haywood Hospital in North County. There's one with Worcester State College and UMass, and there's one more in Rutland.
Last question.
It appears that Northeastern University, after vaccinating those first responders and healthcare workers, took additional leftover doses to vaccinate them eligible members of its own campus community, rather than return those doses to the state where appointments would be opened up to general eligible members of the population at large. Do you feel that that's appropriate? Was that a surprise to you? If you know how many other colleges did that or does that?
I think I'm going to let the Secretary take this one. We did a little homework on this yesterday. My answer is, well, I'll let Mary Lou speak to it.
So Northeastern University, as you said, had extra doses left over and started to work through individuals that they consider to be priorities. And about 2 or 3 weeks ago, when we had conversations with Northeastern, we actually moved some of their product to some community health centers, but ensured that they had second doses, so people who had their first doses would get fully vaccinated. And speak to so they're the only ones that we were aware of that had sort of still had doses available, and then we moved some of their product to a couple of the community health centers. And so they're just finishing off fully vaccinating people that they had started with. And I do not have information that others, we work a lot with the universities and the like, and we appreciate Northeastern not wanting to waste doses.
Are you able to talk about tomorrow the main points that you really want to get across to the legislators?
We've been, the Lieutenant Governor and I have been talking about COVID in all of its charming forms for the better part of the past year, every Monday with the legislative leadership, whether it's about money or about testing or about capacity or about guidance for employers or about vaccines. Secretary Sutters does a call every 2 weeks with everybody in the legislature. off which there are many follow-up communications that come from our administration. You know, the official sort of ask a question and get an answer in 48 hours document at this point since the start of the COVID pandemic is way north of 1,000 questions and 1,000 answers. We've been in regular contact and regular communication with the legislature about all of this stuff for a year, and I think part of the interest in the legislature on this, which is a good thing in my view, is starting to have discussions about the go forward, right? How do we make sure that we deal with all the issues associated with sort of the turning of the page? Not once the page is turned, but the turning of the page, which is sort of where I hoped, God, we are now in this process. And I think that's a perfectly appropriate kind of conversation for us to be having.
Struck me was, in a recent interview, you said it was a lot more complicated than you've ever imagined.
COVID? Oh my God, yeah, start to finish. This is the first time, this is the only pandemic I've ever had to deal with as a public official, yeah.
Is that something you want to relate to? I mean, it seems like everyone criticizes and criticizes, but it seems like you're dealing with such a delicate decision-making and stuff. Is that something that you want to get with legislators if they try to ask you questions about, what advice is not going to be the way that you should?
Look, I think, and I know that the Lieutenant Governor and Secretary Sutters think that the legislature has been a terrific partner in this all the way through. I also think a lot of our colleagues in local government have been terrific partners all the way through. I think people are tired, okay? I am. I know you guys are. And I think we are now at the point where there's actually an answer for people associated with this. There's a vaccine. We don't have enough of it. That creates enormous anxiety for people. I mean, I have friends of mine calling me up and giving me what for about this, that, and the other thing associated with the vaccine. And once I get them down off the ceiling and have a conversation with them about the fact that we're getting 130,000 first doses a week, and we have 4.5 million people in Massachusetts that we need to vaccinate, it at least creates some context around this. But I completely understand why people want to get vaccinated, and they would like to be eligible, and they want to take this off the table, and they would like to get back to something that looks like the life that they had before all this began. And I believe we'll get there, and I believe we'll get there in a reasonable period of time. And I especially am excited about, and I've been saying this for weeks now, that having a third manufacturer in this mix, in J&J, I think is hugely important to how fast the federal government can get vaccines out to states, and how fast states will be able to distribute it to providers and get people vaccinated. And I think a lot of people just wish it would be February or March and not April or May or June. But it's going to happen, and it's going to happen in what I would describe as, in the grand scheme of things, a period of time that isn't like another year of this. But it's not going to happen as fast as everybody would like it to, and I am wildly sympathetic to that. I would like it to happen tomorrow too, but
Governor, is there any change in the supply to the local boards of health? I just asked you that because there seems to be a change with the hospitals. Are you going to get more supply, or are you anticipate being able to give local boards more?
remember, almost all of the regional collaboratives that the Lieutenant Governor talked about are local boards are active participants in them. And there are a number of other collaboratives in development between and among provider organizations, local boards, and others. And I think part of what we're trying to do here is to create a framework where we have lots of capacity around the Commonwealth and the ability to deliver however many doses we get from the feds as quickly as we possibly can. But you got to be able to play at a reasonably significant level to be part of the sort of efficiency distribution channel, which means you got to be doing 750 doses a day, 7 days, 5 days a week. And what we have said to local boards that don't want to participate in collaboratives with others is what we'd really like you guys to focus on is, you know, people who are hard to reach, right? Folks in senior housing, homebound folks, folks who have physical disabilities. Help us find those folks, and we'll get you the vaccine you need to get them vaccinated.
With New York allowing fans, are you thinking about it, letting people go into the garden in Fenway?
We've been talking about this for the past couple of weeks, and as I said before, our goal is to have answers to this question by the end of the week.
Thanks, guys.
Thanks, folks.